name is Dr. Beth DuPree, and I am the Medical Director of the Breast Health Program at Holy Redeemer Health System, and I'm serving as the Chairman of the Department of Surgery. Today I'd like to talk to you about genetic risk assessment. Just this week, the gene PALB2 hit the New York Times, and most people have never even heard of PALB2, but what we know is that there are multiple genes that affect someone's risk of developing breast cancer. But what we're identifying now is that more of these genes have what we call a track record of producing cancers in younger women, and these cancers are also more aggressive, or what we call triple-negative breast cancers. And what this translates into is that prior to this year, the majority of testing for genetic predisposition for breast cancer has been done on the genes BRCA1 and BRCA2. Now we know that there are other genes that also increase someone's risk for developing breast cancer and other types of cancer. So we are now looking at what we call panel testing. And for women who've already been BRCA tested and tested negative, their ears are perked up because they think, oh my gosh, am I a candidate for this testing? What should I be doing? And the idea is not to send out a shockwave. The idea is to say knowledge empowers us. Knowledge gives us the opportunity to move forward and make rational decisions. For someone who's currently undergoing evaluation for breast cancer, the question is, should I be having a panel test as opposed to just the test for the BRCA1 or the BRCA2 gene? And for physicians, what it does is we've said over and over and over again to our patients, ever since we started doing genetic testing, that if I thought that you were at high enough risk to test you for a gene, it doesn't mean that testing negative means that your risk goes back to the general population. It means that you may have a gene that we just haven't identified yet as being a gene that we would recommend doing risk reduction surgery on. So if you're wondering, okay, so what are these so-called red flags? What are the things that we look for to see if I'm at risk? Having breast cancer at a young age, diagnosed under the age of 50, having multiple family members, both on your mother or father's side, looking at the risk of ovarian cancers in family members and relatives, melanomas, pancreatic cancers. All of these cancers we know now are sometimes interrelated when it comes to the risk for carrying a deleterious gene. We look at women that have had multiple breast cancers, bilateral breast cancers. We look at any family that has a male breast cancer diagnosis as another red flag that would pique our interest in testing that patient. Individuals who are of Eastern European Jewish origin or Ashkenazi Jewish descent have a higher risk of carrying the breast and ovarian cancer gene and should also be tested. You could potentially be eligible to receive genetic testing, certainly genetic counseling, to determine what test would be best for your family to receive.